Cabinet Secretary asked states to take steps on war footing to trace attendees of Tablighi-Jamaat congregation in Delhi. Health Ministry says increase in number of coronavirus infections due to the Jamaat congregation. World Health Organization praises Prime Minister Modi for initiating landmark measures to help the poor and underprivileged sections during the coronavirus crisis. Union Health Minister Dr. Harshvardhan holds meeting with Indian Medical Association to review preparedness and action to deal with COVID-19 crisis. Says prevention, containment and management of COVID-19 are being monitored at the highest level. War against coronavirus continues across the world. The number of infected people have now crossed 9 lakhs. UK registers more than 500 deaths in a single day. In United States, death toll crosses 4,500. The National Investigation Agency registers case against terrorist attack on a Gurudwara in Kabul, Afghanistan, killing 27 devotees, including an Indian citizen. It is the first such case registered by NIA related to an incident outside of the country. And this year's Wimbledon cancelled due to corona outbreak will be held in July next year. This has happened for the first time in history after World War II, when the premier tennis tournament has been cancelled. Good morning and welcome to this bulletin. I'm Shubhendu Ghosh. Situation due to infected members of Tablighi-Jamaat has become grave throughout the country, with more than 200 delegates reported corona positive. At least 9 people have died who had attended the congregation in mid-March in capital Delhi. The centre has taken up the challenge of identifying the delegates and the people with whom they came into contact to contain the damage. In this regard, Cabinet Secretary Rajiv Gauba yesterday held a high-level meeting with Chief Secretaries and DGPs of the states through video conferencing and asked them to track the Jamaat members on a war footing so that preventive measures can be taken to contain the infection. Even the Health Ministry has now confirmed that the sudden spike in number of corona cases in the past 24 hours is largely due to the infected delegates from the congregation of Tablighi-Jamaat in Delhi. These delegates then spread all across the country, coming into contact with thousands of other people, multiplying the spread of the infection. Meanwhile, Jamiat Ulema-e-Hind President Maulana Arshad Madani has appealed to people to follow social distancing religiously.
मैं लोगों से अपील करता हूं कि इस मर्ज का कोई इलाज अब तक नहीं दरियाफ्त हो सका, इसलिए एहतियाती तदबीर में सबसे ज़्यादा मौसर तदबीर यही है कि लोग किसी जगह इकट्ठे न हों। मैं मुसलमानों से भी कहूँगा, हिंदुओं से भी कहूँगा कि इस तरह के वाक़यात न होने चाहिए।
WHO has praised Prime Minister Narendra Modi for his efforts to inclusively fight the COVID-19 pandemic. World Health Organization Director General Tedros Adhanom gave example of PM Narendra Modi to the world, the way India has implemented social welfare measures for the poor to combat economic consequences during COVID-19 pandemic.
Countries are asking people to stay at home and shutting down population movement, which can help to limit transmission of the virus, but can have unintended consequences for the poorest and most vulnerable people. I have called on governments to put in place social welfare measures to ensure vulnerable people have food and other life essentials during this crisis. In India, for example, Prime Minister Modi has announced a $24 billion package, including free food rations for 800 million disadvantaged people, cash transfers to 204 million poor women, and free cooking of gas for 80 million households for the next 3 months. Many developing countries will struggle to implement social welfare programs of this nature. For those countries, debt relief is essential to enable them to take care of their people and avoid economic collapse.
As the nation completes 7 days of lockdown, the active cases of COVID-19 reached 1,649. 143 people have been cured of the infection and they've been discharged from hospitals, while a total of 41 people have lost their lives due to the virus. Centre and states are working together to contain the spread of the virus and trace contacts of affected persons. Briefing media, Health Ministry has said that as many as 6 lakh people are living in makeshift camps. Over 25 lakh migrant workers who are rushing home were provided with food at relief camps. Centre has also said that 47,951 tests have been conducted till date. There are 126 labs in ICMR network, including 51 private labs that have been approved. Union Home Ministry has issued consolidated guidelines on lockdown measures to be taken up by the ministries, departments of Government of India and states, union territories to break the chain of transmission of COVID-19 in the country. It was observed that some states and union territories are allowing exceptions beyond what has been permitted under the lockdown measures as contained in consolidated guidelines issued by MHA under Disaster Management Act 2005. In pursuance of this observation, Union Home Secretary Ajay Kumar Bhalla has written to all state chief secretaries and union territory administrators requesting them to strictly implement lockdown measures in letter and spirit by exercising their powers under Disaster Management Act 2005 to fight COVID-19. Dr. Harshvardhan, Union Health Minister, reviewed the action taken and preparedness for novel coronavirus outbreak with Indian Medical Association at a high-level meeting through video conferencing in New Delhi. During the meeting, they reviewed the preparedness and concerns of medical staff across the country related to COVID-19. The minister also reviewed the status of preparedness in terms of availability of beds, isolation wards, lab readiness for high test volumes. He again appealed to the nation that doctors and healthcare workers should not be ostracized or targeted. Instead, they should be lauded for their efforts in helping the public at large. The minister said IMA and its regional members will make a task force and take proactive role in helping the official machinery at state, district and local levels.
हमने उनको ये अपील की है कि अपने अपने स्टेट में अपने अपने डिस्ट्रिक्ट लेवल पर और जहाँ जहाँ हमारी आईएमए की जो है ब्रांचेज हैं उनके लेवल पर प्रोएक्टिवली वो एक टास्क फोर्स बनाकर और वहाँ का जो एडमिनिस्ट्रेशन है उसको पूरी तरह से मदद करें और हमें आईएमए की तरफ से प्रोएक्टिवली ये सुझाव भी दिया गया है कि वो सब पूरी तरीके से इस कोविड के खिलाफ जो जंग है उसमें सफलतापूर्वक जो है उसको जीतने के लिए पूरी तरह से जुटे हैं.
Union Health Minister Dr. Harshvardhan has stated that prevention, containment and management of COVID-19 are being monitored at the highest level and various actions have been initiated in collaboration with the states. In an exclusive interview to DD News, he reiterated the resolve and said that government is committed to preventing the spread of COVID-19. It will take all extreme and preemptive steps available to stop its spread.
We have a well laid down criteria which is quite thorough and comprehensive, where we are even testing every patient who has an acute respiratory illness and is admitted in a hospital. He is also being tested. It's not only a person who has a history of contact with a COVID affected or an international travel, but it is also a person who has an acute respiratory thing.
The minister also said that India is following a clearly laid down criteria to do the testing.
Community surveillance that we started on 17th of January. Can you believe it, when I am talking to you today,
We have more than 5 lakh people in this country who are under community surveillance, and our health system, with the help of our other you can say grassroots workers like surveillance officers and rapid response teams, etc., and ASHA workers, we are keeping a, you can say, very close watch on these people. If he or she is an old person, so virtually it's a daily contact with them. So a watch is being done with the help of all the officers of the and the administrative machinery. We are being helped by the Home Ministry people. We are being helped by the DMs. We are being helped by. It's not only the health department. It's the whole government which is working.
The Press Information Bureau of Ministry of Information and Broadcasting has set up a portal COVID-19 fact check unit that will be operational from 2nd April 2020 to receive messages by email and send response in quick time. The Ministry of Health has set up a technical group comprising professionals from AIIMS to clarify any doubts in the minds of general public on any technical aspect of COVID-19. The Cabinet Secretary has written to all state governments informing them of the constitution of 11 empowered groups under Disaster Management Act with clear-cut mandate to decide on various aspects of management of COVID-19, with a request to develop similar mechanism at the state level as well. Health Department has issued detailed guidelines to deal with psychological issues amongst migrants. State governments have been requested to engage volunteers to supervise the welfare activities of the migrants. The Press Information Bureau will release a daily bulletin at 8 p.m. every day to inform regarding government's decisions and developments and progress on COVID-19. The first bulletin was released on Wednesday at 6:30 p.m. In view of COVID-19 outbreak, Central Board of Secondary Education, that's CBSE, has decided to promote all students of classes 1 to 8th to the next class. The students of class 9th and 11th will be promoted to the next class based on school-based assessments, including projects, periodic tests and term exams that have been conducted so far. CBSE will conduct class 10th and 12th examinations only for 29 main subjects that are crucial for promotion and admission to higher education institutions. Prime Minister Narendra Modi in a tweet urged people to have a look at the Ayush Ministry protocol and make it a part of your lives and share it with others. His tweet message further says, let's keep the focus on being healthy. After all, good health is the harbinger of happiness. And the Ayush update gives various measures and means for boosting personal immunity in order to tackle the challenge of coronavirus better, general measures to enhance body's natural defense system against diseases and viruses. So different ways are listed in the directions by the Ayush Ministry. The directions talks about simple measures that one can take in order to boost one's immunity. Moving on, Prime Minister Narendra Modi had a telephonic conversation on Wednesday with Sheikh Sabah Al Khalid Al Hamad Al Sabah, PM of State of Kuwait. Prime Minister Modi conveyed his greetings and best wishes for the good health of the Amir of Kuwait, the royal family and the people of Kuwait. He underlined the importance that India attaches to its relations with Kuwait, a valued member of India's extended neighborhood. Both leaders discussed the domestic and international aspects of ongoing COVID-19 pandemic. They agreed that their officials would maintain regular contact during the health crisis in order to exchange information and explore avenues of cooperation and mutual support. The war on coronavirus continues throughout the country while the central and state governments together are taking precautionary measures. Common people are also working at their level. On the other hand, awareness about coronavirus is being spread in various states. Non-governmental organizations and local women in Kullu, Himachal Pradesh, got together and sanitized public places, roads, shops and homes by themselves. Bardoli police in Surat, Gujarat urged people to stay in homes and follow the rules. The police spread awareness by singing songs outside of homes, and the local people also cheered the police. Meanwhile, 100 homeless people have been kept in the Dimapur district sports complex of Nagaland. Many organizations are also supplying essential items to the needy. More than 9 lakh cases of coronavirus have been officially detected worldwide since the pandemic emerged in China late last year. Over 9 lakh infections, including 45,719 deaths, have been recorded in 187 countries and territories globally, with some 2,03,608 cases and 4,476 deaths in the United States alone, where the pandemic is spreading rapidly. Italy, with 1,10,574 detected cases, has the highest number of fatalities, with 13,155 deaths. Spain has 1,02,136 cases, including over 9,000 deaths. China has 81,554 cases and over 3,300 deaths. World Health Organization has said it was deeply concerned about the near exponential escalation of the new coronavirus pandemic. As the number of deaths doubled in a week, WHO chief urged citizens around the globe to stand together to fight COVID-19. WHO also warned about the serious social, economic and political consequences in the African region that could turn up if confirmed cases of COVID-19 started spreading. WHO chief urged governments to implement social welfare measures to ensure that vulnerable people have access to food during the crisis and called for debt relief for poorer states. Meanwhile, he also mentioned that a safe vaccine is thought to be 12 to 18 months away and recommended people to wear masks who are infected or are health workers. A Russian military plane carrying medical supply has arrived in the U.S. The plane landed in New York, the epicenter of coronavirus outbreak in the U.S. Russia has previously sent medical supplies and experts to coronavirus-hit Italy as part of humanitarian efforts. The United States has more than 206,000 confirmed coronavirus cases, by far the highest in any country, with over 4,500 deaths. The National Investigation Agency, NIA, has filed an FIR to probe the terror attack on a Gurudwara in Afghanistan's capital, Kabul, last month. The case was registered under various provisions of Indian Penal Code and anti-terror law. Banned terrorist organization Islamic State, Khorasan Province, ISKP, has claimed the responsibility for this attack. The agency said, as per preliminary investigation, one person from Terakur, Kasargod, Kerala, and others who had joined ISKP are suspected to have been involved in the terrorist attack. This is the first case of its kind in which NIA has registered, in recent amendments in NIA Act have empowered the agency to investigate terror cases which are committed at any place outside of India against Indian citizens or affecting the interest of India. 27 people were killed in the attack. Prime Minister Narendra Modi extended greetings on Ram Navami. In a tweet message, Prime Minister wrote, "Heartfelt greetings to everyone on the auspicious occasion of Ram Navami. Jai Shri Ram." Wimbledon has been cancelled for the first time since the World War II because of coronavirus pandemic. The tournament was due to be played between June 29th to July 12th. The entire grass court season has been abandoned and there will be no professional tennis anywhere in the world until at least 13th of July. Wimbledon is the latest major summer sporting event to be called off, with Euro 2020 and the Tokyo Olympics postponed for 12 months. It follows the postponement of the French Open, which was due to begin in May, but has been rescheduled to September to October period. And with the Premier League at a standstill along with the rest of the sporting world due to the coronavirus pandemic, Liverpool players, manager Jurgen Klopp, backroom staff checked in and gathered online ahead of a remote yoga session, echoing the club's mantra to stay home, save lives, in line with the overall message to keep in touch and stay active together with family and friends. The players joined online one by one. English soccer is suspended until at least 30th April. due to coronavirus crisis, but the current season can be extended indefinitely, the English Games governing body said in a joint statement on March 19th. And celebrities have taken to social media to appeal to fans to stay safe amid coronavirus scare. They urge people to stay at home and follow the precautionary measure to fight against the pandemic.
नमस्कार, मैं आशा भोसले। दिल चीज क्या है, आप मेरी जान ले लीजिए, बस एक बार मेरा कहा मान लीजिए। मेरा कहना यही है कि आप अपने घरों से मत निकलिए, क्योंकि हमारा भारत देश बड़ी लड़ाई लड़ रहा है और इस लड़ाई में हमें जीतना है और हम ये लड़ाई जीतेंगे, जरूर जीतेंगे। मुझे विश्वास है कि हम जीतेंगे। जय हिंद।
இன்றைய பாரதத்தின் பிரதம பிரச்சனையான கிருமி யுத்தத்திலிருந்து மக்களை மீட்டெடுக்க நமது பாரத பிரதமர் மேற்கொண்டிருக்கும் நடவடிக்கைகளுக்கு வழிநடத்தும் தமிழக அரசுக்கும் செயல்படுத்தும் மக்களுக்கும் என்னுடைய மனப்பூர்வமான வணக்கமும் நன்றிகளும். உலகையே அச்சுறுத்தி கொண்டிருக்கும் இந்த கொடிய நோயிலிருந்து சாமர்த்தியமாக தப்பிப்பதற்காக செய்யும் சத்தியாகிரகமே இந்த 21 நாள் ஊரடங்கு சட்டம். இந்த 21 நாள்ல நம்ம என்ன செய்ய போறோம்னா, ஒரு நல்ல விஷயத்தை பிராக்டிஸ் பண்ணோம்னா அது இயல்பாவே நமக்கு மாறிடும். அல்லது ஒரு கெட்ட விஷயத்தை நம்ம விட்டுட்டோம்னா அதுவும் நம்ம இயல்புல இருந்தே போயிடும்.
Namaste. Governments and health experts around the world have requested us to stay at home and not venture out. Yet, I hear about people not taking it seriously. I even saw videos of people playing cricket in these times. I'm sure everyone feels like playing and meeting their friends. But this is really harmful for the nation right now. We shouldn't mistake this lockdown for a holiday. Please remember, we the people are the oxygen and coronavirus the fire. The only way to stop this virus from claiming more lives is by cutting off its oxygen supply, which means not stepping out of our homes. The least we can do to honor these brave doctors, nurses, and others fighting this war is to follow their instructions. My family and I haven't met our friends for the last 10 days, and we will continue to do so for the next 21 days. See this as an opportunity to spend quality time with your family. Save yourself, the community, our country, and the whole world from this virus. Thank you.
दोस्तों, मुश्किल कभी बताकर नहीं आती है और ना ही उससे भागा जा सकता है। आज हमारे सामने मुश्किल है और हमें उसका सामना करना है। इसका सामना हम कर सकते हैं घर पर रह के। अगर हमारा काम ज़रूरी ना हो तो प्लीज़ घर से बाहर ना निकले। हम खुद की जान ही नहीं, दूसरों की जान को भी खतरे में डाल सकते हैं। जिन लोगों के पास ऑप्शन नहीं है, जिनका घर से बाहर निकलना ज़रूरी है, जैसे पुलिस वाले, डॉक्टर्स, नर्सेस, सैनिटेशन वर्कर्स, उनका काम और ना बढ़ाएं, उनका काम और मुश्किल ना करें, उनको मदद करें घर पे रह के। इसीलिए प्लीज़ स्टे होम, स्टे सेफ.
And remember to follow simple hygiene techniques like hand washing regularly to keep coronavirus at bay. With that, we conclude this bulletin. Take care. Namaskar.